Hey everyone, welcome back to our channel, The Dental Duo. My name is Kathleen and I just started my D2 year and I'm so excited to show you guys everything we've done so far. To start off, D2 is a super lab heavy year. Right now I'm taking a removable prosthodontics class where we're slowly creating a complete denture. Here I am making some grooves on my cast in order to let the plaster really stick onto my master cast when I articulate it. And then after that, we did the face bow and articulation just to register the patient's bite. And now for the fun part, we got to mix some plaster and pour it onto our cast to articulate it. Moving on to the next part of this assignment, our professor gave us this cool 3D printed piece to put onto our cast, in which we're going to replicate the rest of the mouth using these occlusion rims, which we will mount onto this 3D printed piece. And here it is, mounted onto the 3D piece. Now we're going to make some grooves into this pink wax to allow for the teeth to be placed. I'm constantly checking the alignment and making sure each tooth I place is in an accurate position. Then I did the same thing for the mandibular teeth, and as you can see, this canine is a bit too slanted, so I had to correct that real quick. And that's the finished product. I'll be working on the posterior teeth next class, but for now, let's see what Nico is up to.
Hey guys, so here I am at the dental school library at work. I'm watching some college football in addition to some crown preps, learning all about them before I give them a shot. LSU scored, not good. Anyways, here I am in lab. I start getting my station ready, get my loops on, gloves on, and we're ready to go.
Everything's okay, Dr. Musa. Thank you.
Shout out to Dr. Musa. What we're working on today is crown preps. And this is actually my second time doing a crown prep. And I am on the struggle bus. These crown preps are difficult. This crown prep right here is my first crown prep. It honestly didn't come out too great. So here I am drawing out the cusps. When you do a crown prep, you essentially want to shave down your cusp to around this shape. You don't want the cusp tips too sharp, but that'll give you an idea of that photo as well as that one. And we have a lot of measurements that we have to follow, such as shoulder measurements, occlusal reduction, cusp reductions, etc. And here I have my putty, which I use to measure how much reduction I do. Here's some drilling. I use a putty as you see right here. It's the best one I've done. Still doesn't look great. Four crown preps later and a good 6.5 hours, and still not happy with the final result. But you know, that's part of learning. I don't know why I expect to be great on my first crown prep because it's unrealistic expectations, but it's all good. Gonna come back tomorrow, put in more hours. Just gotta keep working hard. Welcome back to Stab Lab. We have Brett again.
What's up?
We have Sung. We're ready to get numb. You guys know the drill by now. What flavor do we have today? Cherry?
It smells like cherry. Alright, close down on that.
So Brett, what would we need to use this block for?
Basically anything on the mandibular, especially for the molars. It's a little too thick to do infiltration, so that's why we use the nerve block.
Awesome, cool.
You ready?
Yeah.
Feel good?
Yeah.
Okay. Grab that for me. Alright, Song, lean back for me. Open up nice and wide. And there we are.
That was perfect. How's that, son?
Well, Felty.
Hey, let's go.
You still feel your cheeks? They still work?
Alright. You really gotta like pressure it down to like get, like I thought I was like really close, like doing a lot, but
Yeah.
a little bit
Which
over
is
half.
good though. It's better to go in slowly
Yeah.
than to really just like gun it, because then like he'll actually feel pain.
Sung just got numbed by Brett. Now it's my turn to numb up Brett. So
Let's do it.
looking forward to that. I'm gonna change gloves real quick. Alright, so first things first, I'm gonna get our benzocaine. It's gonna be a anesthetic that will affect his gingiva so he doesn't feel it when I poke him. Which side do you want to get it?
Dealer's choice.
I'll go with the same side. Alrighty, so we're gonna go on this side. See right at your masseter as well as your medial pterygoid. I'm gonna go right in between. You get that whole area numbed up for you. Alright, and you can close down on that. So while the benzocaine works on Brett, I'm going to start setting up his needle. We are using carbocaine today, which does not have epinephrine, just so he's not numb for multiple hours. Now we're gonna get our carbocaine, put it right in there, give it a good kick. The harpoon locked in, which we can see it did as I pull back. The carbocaine comes back with it, so that's a great sign. So we're gonna use this cardboard card to ensure I don't get poked. So we're gonna unscrew this cap. It's gonna expose this short needle. That's what's gonna puncture the carbocaine. There we go. Make sure there's a little bit coming out. Good to go. Pull the cap off and our needle is ready. We're gonna use my empty mirror to retract your cheek. So I'm gonna go in for the first premolar. You're doing great. How's that?
Nice. Didn't really hurt.
Really?
Yeah, good job.
Man, my tongue's numb right now.
Is your like lips and stuff numb?
Yeah, my cheeks are numb.
Okay.
I think the lips are numb. Yeah. Okay, let's go.
I hate this part. Alright.
Sung's a pro.
Dude, nice. That was a great injection. I really did not feel. That was a very good job, son. Great job.
And we're back in lab, this time for root canals. We unboxed all of our materials for endo and there's a lot. I dread setting up and packing up each time because there's so many little materials that are so easy to lose. Other than that, I'm really enjoying endo. It's really cool working in the canal and monitoring your progress with x-rays along the way. First, we worked on tooth number 8, which was relatively easy because it only has one canal. First step is to drill the axis, which needs to be a triangular shape, and then we clean out the canal using hand files while irrigating in between each file. It gets pretty repetitive, but it's still cool to see how the whole process plays out. We had a few sessions to practice before our practical, which went super well. After working on number 8, we moved on to the molars, which are much more difficult because they have 2 to 3 canals. This was number 19, a mandibular first molar with 3 canals, 2 in the mesial root and 1 in the distal root. The axis is also a triangular shape, but since it's 3 canals to find, it's definitely a challenge. For example, here I drilled too far distally, which made it difficult to find the distal canal. I started over because I wasn't too happy with this prep, but this got way easier with a lot more practice. So in order to start over, I had to remove the tooth from the typodont, which as you can see here, it was quite the struggle because the tooth is held onto the typodont with putty that hardens over time. So I had to use my hemostat to really get in there and take the tooth out. So here are my 2 molars ready to be mounted, and here's a special guest appearance from my friend Bree. And now let's get to mounting. Here's how it looks, and now we're ready to start the axis. After trying number 19 again, my axis was much better and much more conservative. I also did number 14, a maxillary first molar that also has 3 canals, and I was super happy with it. Thank you guys so much for watching.
Don't forget to like and subscribe and stay tuned for the next one.